Hello, everybody. Hi.
Hello, bună Constantin.
Hello, bună. Ça va? Well, we are
Ça va
now
très bien.
live from Bucharest in our CRONOSMED Instagram, talking about a subject I like very much and something which is suited very well to the time we are living now. Online consultation, web consultations. We know today that there are a lot of discussion about skin trend. It's talking about how much we can balance between, let's say, non-makeup and patient with skin care. Actually, around 18.6 million are non-makeup looking for this. Also, we are talking about a no-makeup selfie, about 512K. Also, a lot of, probably 166 are talking about no make-up needed. More and more skin care. This is why today there is a huge trend in moving from natural, from makeup, non-natural to natural, which is more a glowing skin created by something which is much more appropriate for a fresh look, which is a subject of our discussion today. This is why I want to introduce Mr. Harry Arampatsis, PhD, France, talking about a system which I met a few years ago, which I'm using now in our clinic. It's called Universe Skin. Please, Harry, tell us a little bit what is Universe Skin, how it's working, what makes special this concept.
Ok, bună Constantin. Ce faci?
Hi.
So from
I'm okay.
Romanian, I will do it in English. I think it's better in English.
Do you
than
think
French.
I need to translate for our patient? No, I will let them to understand in English. Only it will be necessary, probably I will speak a little bit Romanian.
Okay, with pleasure. Thank you for inviting me. And we are here in the beautiful south of France, connecting with a clinic, CRONOSMED, and with a beloved doctor, Constantin, which is a very good friend, and I admire him also as a doctor. Talk about skincare. Yes, it's true that today the biggest trend, and even in Fashion Week in early January before lockdown in Paris, there was more and more designers, but they made the podium with no makeup. And it's true, it's one of the most important hashtags today. So no makeup, natural skin. I was even speaking with a very famous makeup artist from Australia. Her name is Ray Morris. You can follow on Instagram. And it's funny because what is for me completely nonsense is to give advice to people how to make up in order to look like they have no makeup.
I just wanted to ask you, really, you don't think that the makeup pushing to this procedure are not going to come back now to push people to say, I can now simulate makeup like fresh look?
I mean, of course, if you talk from an industry point of view, if people start using less makeup, it will be billion losses for all the companies making makeup. So they have to be proactive and they have to discover a makeup, not to make makeup. So this is completely nonsense to me. But nevertheless, it is a real trend. People, they want to look natural. And also we are in a period of lockdown. And what I like to say, if we have to stay close in a cocoon, let's be out like butterflies. So it's very good that we are able to discuss and give some tips and tricks about the skincare, because skincare is, when we talk about facial aesthetics and facial beauty, and beauty is also skin health. I mean, you cannot be beautiful without having a nice skin health. It's quite key to think about what is skincare about. I mean, I know.
Let me tell in Romanian,
Yes.
skincare, how we can translate the skincare. Probably skin to be treated. But skincare is not only medical, it's a complex word.
Skincare is skin health. And when we're talking about health, there is a scientific approach. So we can have a medical approach to skincare. And
yes, please.
So we can have a medical approach to skincare. You know, I'm very close friend with many plastic surgeons. Stephen, our common friend from Australia, Arthur from Canada, and they all say the same thing. I mean, using the right skincare is 80% of facial aesthetics. The 20% is injections, and maybe once in a lifetime is plastic surgery. But actually, what you do at home and in the long run is as important as what you do in the practice. So the 80-20 percentage.
Well, this is not so nice for me as a doctor. I want to see my patient in my clinic. You said 80% on your studies and statistics show the patient want to stay home, and 20% want to come to visit us.
It will be good one day to share with you some photos, but maybe we can do it later at the end of our live to show you what is, for example, the impact of a sunscreen. When you have a younger, 20, 22, 23 years old, you talk about sunscreen, okay, the generations today are more sensitive. But if you see two females, 50 years old, once you use sunscreen, and the others who didn't use, believe me, the difference is huge. The one that is using sunscreen, he has a more young, healthy appearance, but the one that he doesn't use. The same thing with skincare. Mm-hmm. So to be back on the skincare is important because it's like the dentist. I mean, if you don't take care of your teeth, if you don't brush your teeth 2 times a day, if you don't pay attention every day, what you want to do the dentist to do? I mean, the dentist will have a very difficult mission. So, Constantin, we are not here to, patients will be back to you. We are just here, and we know this because we're working together to help in order to give a guidance of the 80% that has to be done at home. And of course, you have all the techniques and the know-how. And today the industry is very innovative to supply with the best products to take care of a holistic approach.
That means we need to treat daily. We need to protect daily to go back to the normal life. And we need to moisturize the skin. These will be some tricks we are going to discuss at the end. Okay, tell me a little bit about the concept.
Okay. Universe skin is a very simple idea. Actually, I spent many years working for very big, maybe the world leaders in cosmetics, and also I have a scientific background. As you say, I'm a PhD in skin dermatology and physiology. When you look to it, in the end of the story, everybody is using a cream.
By the way, you can see now on the screen some magic of this. It's like an alchemist, no?
Yes,
putting together different potions.
The doctors, it's a medical logic. First of all, we make your own cream. Why? Because we are doctors. And we as doctors, we see individuals. I mean, Constantin, when you see patient, you can say nobody is the same. No wrinkle is the same. Nobody has the same habits.
It's personalized, okay?
Yes, exactly, because you see individuals. You don't see populations. You don't see ladies 40 years old with wrinkles. Every wrinkle is different. Everybody is different. And the habits of people are different. And so we see the patient as doctors. So we see individuals. And we follow medical logic. So we make a diagnostic, a very analytic skin diagnostic. We have worked many years, and we have spent a tremendous amount in order to be able to provide the doctor with the tools to make the right diagnostic. And we have worked a lot also to make this diagnostic easily accessible, because we know how precious is your time. And what we want is to be able to the patient to connect with you, either in your practice, but either also a distance, provide you with all the characteristics of a skin through a detailed questionnaire or through just a photo, because today we have a technology.
By the way, that means it's fresh, no preservatives inside.
Yes, because
it's personalized, yes?
Yes. First of all, it's personalized. It has a medical logic, so it has a very big diagnostic behind before you say this is the right formula for my patient.
Mm-hmm. And it is a combination of how many products, at the end, how many formulas?
Actually, you have behind, you can see all the actives. We have 19 actives.
You are at your office. I can notice. It's like an espresso. I like this concept.
Yes, exactly. Actually, you decide which is the actives that your patient needs skin. You decide about the concentration. You integrate the actives in a super serum basis. And then you mix it in front of the patient.
Freshly.
Yes, the fresh is key because, for example, when we talk for actives like vitamin C or retinol, freshness is key. And if we compare today cosmetics with food, we all eating canned food. Or freshness in cosmetics is very important. So the whole idea of university, the whole revolution, is to have the factory, which means the place where the product is manufactured.
Close to the patient.
Exactly.
Well.
So likewise, many difficulties, like combining actives but they are not compatible, decide about the freshness, use less chemical preservatives, and have a more efficient product. I mean, fresh means efficacy. It's not just the preservatives. It's all the efficacy you get by the active. And this is key in the process.
You work with your team, and I know it's a very hard team, to do this concept a lot of years. It's like you are really predicted what will happen now, because this is more and more showing that we can stay home. We can have our formula very easily on the consultation online. Actually, today I had my consultation. Some of my patients ask me, how can I have a formula for my face now in between passing from springtime to wintertime to springtime? And I told my patient, please follow us on Instagram and you are going to see our formula. That means I can send my patient a software. I can take a picture. Patient can send us a picture. By the way, I received 3 patient pictures and I'm going to share with you to show me the way to prepare the formula. You can create the formulas. It's a serum, night and day. And then we can mix freshly, send to the patient. Please tell us about this.
So we spoke about the serum. It's a treatment. It's fresh. It's personalized. It's following a diagnostic. And the diagnostic can happen remotely. Latest, we're able to collect a lot of photos. You know, Constantin, but we have more than 2,000 doctors using the product in 40 countries. So the last years we collect huge amount of photos. And you send me 3 photos.
Yes, I sent it.
But you can describe to me, I think it's 3 patients. You send me, I have only the first name because for confidentiality reasons we don't give the full names, but you send me Alexia, Elena, and Julia.
Yes.
So,
there are 3 different, by the way, I like very much as a plastic and aesthetic surgeon to treat aging faces with pigmentation, also, and patient with wrinkles and sensitive skin. But at the end, I like a lot of the young generation have a lot of acne. And your treatment, really, it's fantastic. I've seen the results. I'm amazed. Tell me a little bit about what is the key writing on the screen. It's what about this?
Sorry, I'm not sure I understood the question because the sound
on the
was
screen now, as you can see, there is a writer. You can tape and to screen something. What is this? A way to catch the software, how to introduce the patient name and so on, yes?
Okay, so actually it's very simple. I mean, we will make a live demo to see everybody. You send me 3 photos by
yes.
WhatsApp.
Yes, I sent it to the picture before.
Yes, and we can, and I run the analysis. This
okay, now it's the way you are analyze that case.
Yes, actually we run the analysis, and what's the idea, Constantin? You know already the system. It works by AI. So actually it's comparing the photos.
Let me tell my patient, AR, artificial intelligence. It's something now which is the future. Yes, you can see now on the screen this.
Yes, exactly.
Take the picture.
So this is our first patient, is Elena. So we have wrinkles on sensitive skin. We can see we have UV damages, oxidation, pigmentation, wrinkles on a sensitive thin skin. So this patient will not tolerate aggressive acne, will not tolerate glycolic, will
which
not
means
tolerate...
it's a sensitive skin, a sensible skin.
Exactly.
And you can see the color of this face.
Exactly. So once we run the photo in the photo analysis, we have the first spider chart, which is using our color system. So you can see already the patient, what is the global outcome. So it informs you that you have a patient with sensitive skin. We analyze the photo, we analyze the skin thickness, if it is a thin or a thick skin, which is key to define the formula. Then in the next step, you can correct the analysis because a photo is not everything. The doctor has
that means I will be not out of this. I will still be behind this consultation. No, this is a good thing.
You know what? Many times journalists ask me, AI, will the AI replace the doctors? For me, I don't like to talk about artificial intelligence because This is collective intelligence. It's the intelligence of the data which is collected by thousands of doctors over the years. And it's the intelligence of the doctor that thinks the patient in this moment, he knows better his patient, and he can check the photo, and he can correct the analysis. So actually, the artificial intelligence is nothing else of a knowledge of 2,000 doctors.
That means the experience of a large community of doctors.
Exactly.
Which will be at my fingertip now to use it, even I'm not so well informed. That means it's a faster education and experience.
That means, Constantin, that your patient, they will be able to have more access to you, because what you need normally half an hour to do it, you are able to do now in less than 2 minutes.
Okay, that means actually now I'm going to help my visit using your assistant, software assistant.
Exactly.
Tell me a little bit, the next step.
So the next step. So once you have the photo analyzed, you correct the formula, you have the formula established, and then you send the formula to your patient.
Okay, this is another cases?
Yeah, so actually I'm not able to see the screen. I think we already run, my team behind is running the second photo.
Okay.
It's a melasma on a 32 years old
Very
patient.
well received by patient and look for patient to fix it. Melasma and pigmentation.
Exactly. And this, of course, in a melasma is very important to use the right sunscreen, but also it's very important to be patient. Right now is the right moment to treat melasma because people, they stay at home. There is not too much sun exposure, not yet. And you're able really to use the actives, but you're not able to use during the summer. So it is the moment to treat melasma. And how we treat this patient, we have a melasma. She's a phototype 2, which means she has a fair skin. She looks good. The pigmentation of the face, it's what makes the light reflecting in a very bad way. This is the reason that treating the pigmentation is key in the facial aesthetics in beauty. So we make a formula day and night. The day we give a lot of antioxidants.
Which is that small bottle, yes?
Yes, exactly.
With a nano formula inside. This is a magic.
With
it's
nano emulsion.
Revolution,
with the nano emulsion, yes. Well, we integrate the actives. So actually, in the day formula of this patient, we give SOD, which is a powerful antioxidant. We give vitamin C. And the night formula, we go more with actives like arbutin and kojic and niacinamide to the melasma. I think in 60 days, we can see the improvement. Of course, I just receive a photo. If I have photo of patients, but they're older, I could see also the after result. But in really 2 months, we can see the difference.
By the way, you talk about vitamin C. We know very well that vitamin C, it's coming from fresh oranges. Also, there is a big discussion how in classical skincare, vitamin C is not fresh. Actually, lose the antioxidant capacity.
The efficacy, yes.
In your efficacy. In your formula, it's fresh. Why it's fresh?
Look, I think you give the answer as well, because we want to have the best of the vitamin C in our product. So the way we do, we integrate the vitamin C and we mix it just before the use. So likewise, we have a vitamin C that is very active, but is stable for the duration of the use of the product, which means the product actually duration is 2 months. So for 2 months, we have all the stability data proving that the vitamin C stays stable in the bottle. And
by the way,
likewise,
sorry, now your team is running something about very particular and interesting topic.
This is a free case you sent to me.
Young generation.
I was asked a type 1, as you see, a dermatologist. So it's a very sensitive skin. She has redness, permanent redness, like a butterfly on the cheeks. We can see it. She has also some pimples, less now. She has pimples from time to time around her menstruation. And it's an extremely sensitive skin. And every time she makes a pimple, she has a brown spots that stay on the face. This is what we call post-inflammatory hyperpigmentation. So actually, for this patient, we make a formula with the necessary actives. Of course, it needs anti-inflammatory actives. It needs azelaic acid. It needs niacinamide. We will not use vitamin C of this patient because it's a sensitive skin. So if we use vitamin C as an antioxidant, it will make a reaction and it will have more pimples after. So this is what we can treat, because you can see that both faces, they have completely different formulas, completely different treatments, completely different approach. but based on the medical logic. You say, what is the skin? What is the patient? What I see? What I need to treat? I have 19 actives, my 19 Nespresso cubes. I will pick up the right actives from the right concentration. I will mix it and I will give it to my patient. You know, as I say, what we do today is somehow find the way to bring the best of the past in the future. I will explain myself. Before, if you want to have a dress, it could be only a tailor-made dress. It will not be possible to go and buy off the shelf a dress because there was no other option. Today, people, they have too many options in skincare, but if we go back to basics, if we want to have the best possible product, it should be tailor-made. This is what fits the best. This is where we have the best efficacy and the best tolerance. Because this is all about the personalization and the freshness. Is to have the most efficient product, but give you healthy, glowing skin with the best tolerance, which means you don't make any reaction, you don't have redness, you tolerate your cream like a second skin. You don't think about how I'm going to react. And this is what brings the perfect skin, Constantin. And you know, this is the secret of university, the freshness of the personalization. Then behind this, we have all the tools accessible. I know you are a very, very modern and technology-friendly doctor to use it. And what is the Avadat? The Avadat is that you can treat more patients faster and safer. So actually, if we consider that your time is precious, this is what makes the product affordable and accessible to as many people as possible by combining this experience, the manual with the technology, the know-how of a lot of doctors together, the know-how of a unique doctor that sees the patient.
Well, resuming, I can now start my visits online.
Mm-hmm.
I can use the experience of thousands of doctors all over the world how to make my best formula.
Exactly.
I can ask the patient using the Skin Access software with the phone, just simply taking a picture in a very good condition light without makeup.
This is very important. Sorry to interrupt you. No makeup, the right light. It's better to make a selfie or someone else can take the photo, or the background is not very important. The most important is white.
Daylight is very good, probably.
No makeup. Yes, exactly. And with a smartphone.
And about 5 to 10 minutes, filling a questionnaire to be more precise and more accurately in the data. And then I can have my formula. Me as a doctor, I'm checking all. I send back my patient my formula, and meantime, if the patient wanted, can order directly to the laboratory, Universkin or your laboratory close to my area.
Exactly. We have organized, the laboratory is less than 1 kilometer from CRONOSMED clinic.
Yes.
Every formula that they will be ordered by your patient,
the patient
will be freshly mixed and delivered.
Okay. Say, yes, I want it. It's receiving, and the formula, it will be available for a treatment about 1 month?
It depends on the formula that you will make. It will be between 6 weeks and 2 months.
Which is perfect, because instead to have a large bunch of classical skincares, I have only one small bottle in my pocket, and I can treat it.
Our aim is to empty the bathroom of people, because I see many friends, and you know, I'm very curious. Every time I'm invited, I always like to open the bathroom and see what is inside. First of all, if they use my products, but nevertheless, you see so many cosmetics accumulating, so many products. And when you ask, do you use all of them? No, I bought this one because a friend has advised me. I bought the other because I saw it in the magazine.
Because it's caviar inside, no?
Yes, I bought the other because
it's gold.
I like the bottle. Do it. Yes, I bought the other because I was in the pharmacy. They give this to me. I bought the other because he has a nice perfume, because he has a low price. Finally, people, they have huge amount of product, but they don't use. And everybody, at the end of the story, is using someone else's cream. They don't use their own cream. They use the cream but someone else has used, and he says it's good for you. How can it be good for you? I mean, it's someone else's cream. What fits to your skin, Constantin, doesn't fit in my skin.
Until now, the last 3 years, I use Universe Skin formulas in my clinic, having a catalog with the ingredients, using my experience how to mix it, also accordingly to the different 8 syndrome, 8 skin types. Now I can do my visit online, assisted by experience. I can immediately order the product. The patient can receive it freshly 1 kilometer round radius from the clinic. I will be in touch. What about the next visit? I can do the second visit or the post-treatment.
He can do the next visit. We hope that this lockdown story will be finished. You can do the next visit at the clinic at CRONOSMED, or you can do again the next visit on distance.
Which is, from a point of view, a sort of lockdown. I can do it my home. I can do remotely.
Exactly.
And I can have the results on my phone. That means everything is here.
It's very simple. People from the couch, from the comfort of the living room.
I will ask my team to send me a small magic vial, please.
Okay.
I want to share with you. By the way, you can have there behind you. Okay, let's talk now about the next stage. I treat it now. I'm happy. What can I do else?
Okay. So, you know, in a classical skincare routine, if you want to simplify it, there is 4 important steps.
You see now that we have Nexulta O. Okay, let's talk a little bit. What is O?
First step is to clean. And for cleaning, universally, we have developed an olive oil-based cleanser, but it can be used to clean the skin, for the makeup, or the sunscreen. It's very good for stubborn makeup, waterproof makeup. It's very good for very sensitive skin. Why oil? Because oil cleans oil. So if we want to correctly clean the face, especially now that most of the females, they have a trend to use waterproof makeup or sunscreen, we need an oil cleanser. The oil cleanser is the best to clean the skin. But at the same time, you can use this cleanser not only for the face, it can be used to clean the eyes, for the makeup, but also it can be used in the scalp.
Okay.
So the scalp is very important because we have a lot of ladies with thinning hair, using too much hair dye, and they have an itchy scalp. And this olive cleanser can be used also in the scalp. So actually you make a massage with the oil, you let it in about 30 minutes, and then you can rinse with your shampoo. Or it can be used as a mask. So many women, they use it as a mask. So they apply it before sleeping for 30 minutes, then they rinse it, and it's a great mask to hydrate the skin. And you know, the olive oil is a magic ingredient. It has anti-inflammatory process, it has antioxidant process. And our olive oil is very special because it's one of the purest olive oil you can use. It has no emulsifiers because the olive oil can emulsify by itself. We have a little bit of lavender and rosemary inside. It's very specific, very technical extracts. You know, I'm a Mediterranean. I love
Let's talk about, Mediterranean, because it's from Nice. You have a very good oil, and probably this is the original idea. It's not only for eating Mediterranean food, but also Mediterranean oil. By the way, as a plastic surgeon, I'm always recommending my patient, even before and after surgery, I'm talking about facelifts, rhinoplasty, breast, to really enhance the quality of the skin before and after. And I have formula also which are mixing about with your ingredients to do before fillers and after fillers, to do before and after facelifts, rhinoplasties, and other area, because skin, it's everywhere. Without a good quality skin, we can't really get a good quality aesthetic surgical or aesthetic medicine result.
But
well,
also it's a barrier.
It's a barrier, I mean, it's a protection. Yes, by the way.
I mean, we have a lot of people, but
now,
they have
age. What about age? I like this movie. It's fantastic. Even the product, I use it a lot. the way of delivering the product. This is another, let's say, innovation of your line.
Yes, B8 is a hyaluronic acid, a pure hyaluronic acid. It looks like a serum, but it's pure hyaluronic acid. It is the same hyaluronic acid, the same quality, it's pharmaceutical grade, but it's used for the injectable products. We have a different molecular weight of hyaluronic acid. The aim is to work on the surface and restore the skin barrier, so repulse the skin, hydrate the skin, but also work beneath, which means boost the fibroblast, boost the hyaluronic acid of the dermis. You know, hyaluronic acid is what it maintains the water. The skin, especially the layer after the epidermis, is full of elastic compounds, the elastin and the collagen, and also hyaluronic acid. I mean, it's very classical test. When you pinch the skin of a hand, if you have a baby, the skin will go back immediately. If it is an older person, the skin stays, has less elasticity. So hyaluronic acid is part of what gives volume to the skin, is what keeps the elasticity of the skin, and is one of the key ingredients in skincare. From our side, we use it as an acid. So actually, you can use it alone, or you can mix it with your serum, or you can mix it also with EO and have a great mask that you can use during the night. So it's a multifunctional hyaluronic acid. And I think that if we stay on the hero ingredient in skincare, you cannot have a correct skincare routine without having the right hyaluronic acid serum. And then the percentage of hyaluronic acid inside is not the most important. The most important is how it's designed and how much the skin can absorb. This is the most important.
Well, I like age. I like hyaluronic acids because we are doing a lot of facial remodeling, improving or with anti-aging purposes. Why only inside? Also outside hyaluronic acid, it's a good
of course, it helps. And there is a lot of studies, so it helps.
And complementary therapy. Well,
Next
Ultra H, amazing product for everything.
So clean.
Okay, clean.
So we can clean with the oil.
Hydrate.
We can treat with the serum and with the hyaluronic acid, but they can be mixed also. I mean, the serum can be mixed with the hyaluronic acid. In university, we believe on the mix and match. Mix and match, what it means.
But now it's something very nice. I like this brush. What about this? It's protection.
Well, you know, sunscreen is key. And the sunscreen is maybe the most important step of the skincare, is the protect. And for this, we have developed a little brush. So why make a sunscreen in a brush form? Because sunscreen, you need to renew it every 2 hours. Most of the women, they wake up, they put the skincare, they put the makeup, they put the sunscreen. And after 2 hours, normally they have to renew again the sunscreen. So what are you going to do? You're going to take out the makeup and you're going to put the sunscreen and you're going to make up again? This is not possible. So this is the idea to make this little brush. Okay? You can apply it like a brush, but this powder has mineral filters, but give a protection of SPF 50. And this is what is great. I mean, we can see Anka behind. It's so simple. You can stop any moment, anytime, and just brush on your skin, and you renew your sunscreen. So this is important because if you renew your sunscreen every 2 hours, you are completely protected. And this is one of the most anti-aging effects we can recommend to the patient. Why anti-aging? Because the biggest part of aging is the genetic part, but is also the environment. And UV damages is the biggest part of the aging. So already, if we use the right serum with the right ingredients, and we adapt it to the season, we adapt to the concentration, and we use the right sunscreen after, we have done the 80% of the work. So we have two sunscreens. The first is the powder, which we believe is very important to be used every 2 hours, anywhere, anytime. And then we have also some very nice moisturizers with SPF, mineral always, that can be used also as a makeup basis. What we call it the Next Ultra L like light, because this is a very special sunscreen that was studied not only for UV light, but it was studied also as a protection against the blue light, the light that's coming from the screen.
Which means now we have two kinds of protection. It's a powder. I like very much the powder.
The powder is over top.
Yes.
And the cream is before the powder. So actually, you put the cream. Once you finish, you put you clean your face. You put your serum. You put the L, the SPF 30. Then you put the makeup. And the SPF 30, the next L, is an excellent makeup basis.
Which makes much more protecting against water, if you want.
Yes, it's waterproof as well. And it is a great basis for the makeup because the sunscreen is not only when we go to the sea. It's all year long. This is very important. I mean, we live in the south of France, but also I know in Romania during the sun we have a very strong sun exposure. Sometimes we have people saying during winter I don't need the sunscreen. This is not true. Nobody's living in a movie. We need a sunscreen all year long if we want to protect young and healthy skin.
Which means now we have 4 pillars. Next Ultra O, it's
exactly
cleaning. Then we can treat with the whole bunch with the serum, having about 1,000 more and 1,000 formulas according for age, type, and patient characteristics. More than okay.
Then 800 million costed.
Okay,
800
million. Okay, but I like more or less 1,000 because it's at my fingertip. Otherwise, I will be impressed too much and very scared about having too many formulas. Then I have the capacity to hydrate the skin. Then I have the capacity to protect and to preserve the results. I get it even in the summertime with sun exposure.
Protect and repeat the protection every 2 hours without having to be
Next Ultra L.
Yes, and even if it is a brush, this is what I use. I think it's very practical for men as well because I do a lot of bicycle. So it's very easy rather to put the cream. I take it out, I brush, and it's very easy. My hands are not sticky.
But
I'm not crying.
Yes. The best now for me, it's the formula, the first one, IP. This is the magic. Can you imagine having here in this for 1 month and a half the product to treat my skin accordingly to my skin type and my problems? Let's repeat again a little bit, Harry. We can do the consultation online.
So if we go over steps, what I invite you to do is very simple. Send a photo to Dr. Stan or make the questionnaire online.
Yes, please.
So Dr. Stan will receive all the data in a securized platform. So the data is treated with confidentiality, and it's a securized platform that is dedicated to medical data. Dr. Constantin, then he will make your formula. He can send you the formula by SMS and email. And if you want to use this formula for your skin, then we can freshly blend it for you and deliver to your door. Of course, you can ask Constantin to make your entire skincare routine with a cleanser, with a serum, with the UV protection, which I strongly recommend. The best is to have a full skincare routine. Try to empty your bathroom of what you don't need and just stick to the right products. I don't say universally we are the only one to have the right products. There are many good brands. For us, what we do is to have products in higher concentrations and with a medical follow-up, which is important because as you have products but they are very strong concentrations, sometimes you need to have a medical follow-up, but the truth is that everybody can use it. And stick to your skincare routine. What I'm saying always, be consistent. If you making gym, if you go to the gym and you're changing gym or exercise every 10 days, you will never lose kilos, you will never construct muscles. You need to be consistent. Skincare and globally health. Health is about consistency. Health is about education. Educate yourself, understand what is good for you, having the right guidance, Dr. Stan or any doctor from the university community can really guide you to find your right skincare routine, your right formula. What is the active ingredients your skin needs? When you take it from Universe Skin or not, this is not the most important. The most important is to have the right formulas, the right skincare, be consistent, and you will have the results. You will have the no makeup effect without no makeup. So likewise, in terms even of spending, it's easier to spend for one product rather to have 3-4 products, but at the end of the story will not be as efficient as a product just designed for you.
Which means at the end, in few days we are going to install on my social media, Instagram, the way to get in touch with us for a consultation online. They can have access to our Skin Access software assisting me. They can send a picture, fill a questionnaire, having the right formula, ordering and receiving home. What else, Mr. Harry?
What else? I think that the most important is told. I think we should spend some time if there is any questions from the people that are listening our live.
Well, this is fantastic. I know that you started this project in Canada. It was successful there and Australia, yes?
Yes. Yes, in Canada we started almost 3 months ago, and before the lockdown. With the lockdown, it became even more important because people were not able to go to the doctors, and it's very successful. People are extremely happy, and there are many people wondering what is the right skincare for me, but they don't have the reflex, to say, okay, I will go sit with a doctor, understand my skin, pick up the right skincare, and stay consistent on this. So maybe people that have more time right now, but also with this platform, our doctor community is more accessible. It's more easier than go and meet with you, take an appointment, spend half an hour to do this, so everything can be done remotely. And this is not something that we are working due to the actual lockdown. Is our philosophy since the creation of the company, this to be able to treat remotely as many as people as possible with the right formula, and assist our doctor community with the right tools in order to treat more people better and safer. Well,
there are some questions. I'm sure that you'll be interested to find out some of this. There is a question from UK. We have Romanian people living in UK. By the way, do you have the same project in UK?
It will start with a little bit of delay. I think it will be ready by maybe July to launch the online platform consultations also in the United Kingdom.
Une autre question, French doctor. They are also, but we can send in France too, yes?
Yes, of course. We cannot deliver French patients from Romania. They will be delivered by France.
Well, you can get in touch with us and we can give your formula, and you can buy the product close to your home in different area. Actually, this is another project. We are staying here, we are in Romania, we are in CRONOSMED, we are waiting for you on consultation online. We are doing visit in the clinic. We are waiting for you immediately starting after the corona lockdown, and stay online also. Well, other question. Universe Skin Australia. No, I can imagine this. Well, I hope that are not from there. They are waiting our consultation and product. This is amazing. I like very much, and I like this way of doing things. Well, it's time to move to the last part of our, I hope, interesting and nice introduction to the Universe Skin formulas and Universe Skin world. But remember, in our clinic in Bucharest, we are going to combine not Universe Skin with plastic aesthetic surgeries. We are doing a lot. We are going to use this line before and after treatment for injection, fillers, after Botox, after laser treatment, after energy-based and before an energy-based device. Remember, the skin, it's the largest organ of your body and our body, and quality of the skin it's giving the quality of any type of treatment. And remember, if you don't need treat your skin, you just can use the 4 products, Next Ultra O, Next Ultra H, and then the 2 UV sunscreen in a powder and in the cream.
Just to add Constantin again, because we have some questions also. Do we use sunscreen during the winter? It's important to take into consideration that the UV rays and the blue light, it's also making damages during the winter. If you talk about winter in East, we have a lot of sun. If we talk about winter in where you're going with the snow, you also have a lot of sun. Also, what is very important, but we didn't have enough medical knowledge, but now we know it, and there is a lot of clinical evidence, is about the damages of the blue light, the screen light of the skin. And it is really today proven, we know it, that the blue light has an effect of a pigmentation. Because most of us, we spend even during the night with the sunscreen. I mean, we saw it in Canada, where we have melasma, which was resistant, which means we treat it and it was not going out. And we're not understanding with our dermatologist team what is happening. And when we put the SPF 30 in the night, we start to improve the melasma. So the question is, do I use sunscreen in the winter? The answer is better yes, but definitely yes if you spend a lot of time with blue light, and definitely yes if you have pigmentation problems. If you have melasma, if you have pigmentation, you need to use a sunscreen all year long. And for the big fans of the screens, the one that like to stick to the screen, stick to the Instagram and day and night, or they have to work in a computer, yes, even during the night, it's good to use a very light sunscreen with SPF 30 if you want to get rid of the pigmentation. Again, the protection is not just a question of season. If we protect our face from the UV damages and the blue light, we are maybe able to deal with the biggest part of the environment aging. Then we have other anti-aging actives that are very known, very efficient, like retinol, like vitamin C, like Centella asiatica. There is hyaluronic acid. So there is very well-established scientific evidence ingredients that can be used fresh with very good results. So you know what to expect. You know what skincare can do. You know what Constantin can do with injections, with neurotoxins, with the famous Botox, or even once in a lifetime with facelift. What is the key message? Today, with the right skincare and the right doctor, that can make your skincare, but can make other things, it's your decision if you want to age. Really, we have the technologies today to block a face young and keep it young and make it look young, which is the most important thing, not to look beautiful, but to feel healthy, to see every morning of the mirror and see an appearance that corresponds to how you feel.
Which means we can recommend all these treatment also the young generation to preserve not only, let's say, more aged patient where we need to improve and to rejuvenate. Exactly. It's time now to close our Instagram. A lot of questions. It's impossible for me to really give answer to everybody. That's why my team is going to manage all this and to create a sort of combination of answers, and we are going to give each of you an answer for what is important for you. Today,
it's not in one shot, Constantin. You know how close I feel to you. You know how close I feel to Romania. You know that my wife is Romanian, so it will be a pleasure to be close to you and give all the answers necessary to assist you. For me, if I have a message to give, is take care of your health, stay safe, stay home, and use the right skincare that can be delivered to your home from now on. Actually,
a copy and recording of this Instagram live will be on our social media. I'm talking about Estetica Premium, CRONOSMED live webinar, and why not Universe Skin France. Thank you, everybody. It was nice to be with you today. We are going to do more of this introduction to new concepts which are going and we are using in our clinic. Remember, stay home, but stay healthy and stay joli and beautiful. Thank you, and rejuvenated. Thank you. Bye-bye.
Bye-bye.
It's time now to close. Thank you very much.
Thank you. Bye.